Good afternoon. Thank you for being here. I'm sure you know at this critical time, we really appreciate the professionalism of the media helping get accurate information about the COVID-19 challenge we have, and you're providing a very useful public service, so thank you for your professional endeavors. We want to extend our statewide condolences to the families who've lost loved ones to the COVID-19 virus. Any loss to any family is a tragedy, but obviously, given the nature of this crisis, we feel it profoundly across the state of Washington and nationally, I believe, as well. Our thoughts are with the families that are continuing to recover with this, and we are very hopeful for their eventual recovery. I also want to thank the state and local healthcare workers and emergency management workers, especially the frontline healthcare providers who are with people in very close proximity, helping them get better. Our emergency first responders who courageously have been there always and have been throughout this crisis as well, and we wish them well. We're working around the clock. They are working around the clock, and we appreciate their commitment. I want to give you an update on our state efforts. We have now increased our capacity to get our COVID-19 virus tests back faster. The Department of Health has announced that our public health lab in Shoreline now has the capacity to test for cases for about 100 people a day, and usually that's about 200 tests because they do generally 2 per person. So we have expedited results. The University of Washington will also begin testing, we believe, this week, and their capacity will be in a somewhat similar vein. So I'm very pleased that our state acted as fast as possible ahead of the curve to build this local capacity where we can do the testing right here in the state of Washington. Our Shoreline lab has also ordered extra equipment so that we can continue to build that capacity. I was there yesterday, and it's quite an impressive operation. So our priority now is to slow the spread of this dangerous virus. And I want to say something about this in general, about all of our roles in our statewide response. We can all be leaders in this effort against this virus. You don't have to be a senator or a governor or a president. Everyone can be a leader in this effort. And in fact, some of the most important leaders are all across the state of Washington, not in public office. And the reason is that we can succeed in this if we make our decisions based on calm confidence that is based on science and rational thought and the sense and understanding that we are all in this together. If we make our decisions based on understanding of natural science, which we are so good at in the state of Washington, rather than unnatural anxiety, we will both allow us to live our lives and get on top of this disease as rapidly as humanly possible. So some of the things we've talked about that individuals we hope can help with. Our healthcare professionals say that the easiest way to really defeat this virus are some of the common sense things that we all have control on. We can wash our hands often. We can avoid shaking hands. We can sanitize frequently touched surfaces. And most importantly, because I want to emphasize this because it might be one of the more difficult things, stay home if you are sick. Preventing future cases will require all of us to do all of these things. And the more of these steps you take, this is what health officials call layered interventions, the better off you are. The more of things you do, the more your family does, the greater safety they will have in this situation. So here I do want to reiterate this one. For anyone who's feeling under the weather today or in the upcoming days, but you went to work anyway, I have a message. You got to go home and take care of yourself and try not to put others at risk. This is the hardest thing to do. I understand that because we all feel a responsibility to our positions. But it is perhaps the single most important thing we can do right now to prevent the rate of transmission. So it's quite clear that we are dealing with cases of community transmission in the state of Washington. And so even if you do not think you're at risk of the virus, the steps you take to prepare will help everyone around you. We hope people will seek accurate information and don't accept rumors and unsubstantiated reports about the spread of the virus. Developments are changing daily, and I urge everyone to check reliable sources, including the State Department of Health, and they are online at doh.wa.gov, doh.wa.gov. I also want to talk to folks who might have compromised health conditions. What we have seen in this virus to date is that it seems to be much more dangerous for those who have underlying health conditions. And we do think that people who have underlying health conditions need to give greater consideration of how much they expose themselves to many other people. They have a lot of opportunities to make individual decisions about that, but clearly those that have somewhat fragile health conditions appropriately, we think, need to think about the number of times they're going to go out and be close to a lot of folks. So I want to give you an organizational status. We activated our emergency response system weeks ago. They have continued to build capacity to address the outbreak. In partnership with the State Department of Health and Department of Emergency Management, we're strengthening our preparedness and response efforts, and I'm fully committed to keeping Washingtonians aware of these efforts. Additionally, a team from the CDC federally is now on the ground assisting King County officials in their investigation of the cases, particularly at the affected nursing home. I signed an emergency declaration proclamation on Saturday, and this will help the state provide additional resources to respond to the outbreak. That directs state resources to be utilized wherever reasonably possible to assist affected communities, and also to respond to recover from the COVID-19 cases. It also implements our state comprehensive emergency management plan to maximize statewide coordination of all local officials. And I just do want to note, we have been very pleased of the coordination of multiple government agencies in that regard to date. Over the weekend, officials at the Office of Financial Management spoke with the chairs of the legislative fiscal committees under my direction, and we are planning to ask for $100 million to be dedicated to this response in this year's budget. It would be used for both state and local public responses in regard to these efforts. I don't believe that funding to address the outbreak should be a problem in this regard. The matter is too urgent. We are also evaluating surge capacity in our healthcare system. We are evaluating multiple sites right now in search of the best locations to effectively serve both isolation purposes, as increasing numbers, which we anticipate would need isolation, and also medical services to help those folks in the event that they have symptoms. We've also asked the federal government to release from its stockpile a variety of medical equipment. That came up in discussions today with the Vice President, and I'm reasonably confident that those requests will be honored. People need to begin to think of this in some other realms as well. We think folks should begin to think about avoiding large events and assemblies. And we are not making a request formally right now for events to be canceled, but people should be prepared for that possibility and need to be thinking about it. As this situation develops, what people are likely to see is that local officials, county health, and school districts responding to this. I also have emergency authority in this regard. We are not exercising it today, but people know that we need to start thinking in these terms. I want to reiterate, too, that other agencies have independent authority in decision-making about these activities as well. I know this is a difficult situation, but I want everyone to know that Washington State is involved in a very comprehensive partnership right now. I'm asking all Washingtonians to take care of themselves and their loved ones, and I will look forward to working with everybody to a successful completion of this to get us back in a safe position. With that, I want to turn this over to Secretary John Weisman of our Department of Health.
Thank you, Governor, and thanks for being here today. I'm John Weisman, as the Governor said, and work as the Washington State Secretary of Health. Like the governor, I too want to extend my condolences, and my heart goes out to the families who have lost some folks to COVID-19, and really hope that those who are ill now also have a quick and speedy recovery. Unfortunately, we are now starting to find more cases in Washington state that appear to have been acquired locally, and we know the virus is spreading in some communities here in Washington. We currently have 18 positive cases in Washington state. King County has 14 cases, including 5 deaths. Snohomish County has 4 cases, including 1 death. At this time, we have not detected COVID-19 cases in counties outside of King and Snohomish. But given the movement of people around our state, it's certainly possible that the virus is spreading in other counties too. As the risk of COVID-19 increases in Washington, it's more important than ever, as the governor said, to make sure that we are all taking steps to prevent the spread of any viral infections. Now, these may seem very simple, and we talk about these every flu season, but we know sometimes they can be difficult to put in practice. Wash your hands often with soap and water for at least 20 seconds. That's singing the happy birthday song twice, all right? So stop, take that time. We've all been in the public restrooms where we see people just run their fingertips under the water. That is not hand washing. We need to wash our hands front and back and in between our fingers. Now is the time to increase our diligence here, folks. And if you don't have hand washing available to you, you can use hand sanitizer with at least 60% alcohol if soap and water aren't readily available. Cover your mouth and nose with a tissue when you cough and sneeze, then throw the tissue in the trash and wash your hands. Avoid touching your eyes, nose, or mouth with unwashed hands. This can be hard since so many of us touch our faces throughout the day without even thinking about it. Frequently clean and disinfect the surfaces at home, those high-touch surfaces, whether those are doorknobs, your computers, keyboards that you might be sharing, that kind of thing. And as the governor said, we really mean it. Stay at home and away from others if you're still feeling sick or if you're sick. I know we've all gone to work, as the governor said, when we're sick, but that really needs to stop today. In addition to increase your chances of staying healthy, you should give thought to avoiding crowded settings if possible, especially if you're over the age of 60 or have other chronic health conditions similar to people at increased risk for serious influenza infections. We understand the concerns people are feeling about the situation here in Washington. We too are concerned, but we can take action. All of us want to ensure ourselves and our loved ones are safe and protected. As the governor said, now is the time to be prepared and make sure that you and your family have a plan in case of increased spread of COVID-19. In addition to what the governor said, make sure you have those basic supplies at home, the same kinds of things you should have at home for a snowstorm, prepared for an earthquake. That's what we're talking about. Think about what might you do if you need alternative plans for childcare. Talk to your employer about options for sick leave or telework. And get to know your neighbor. If you're homesick and you need some groceries and you have that relationship with your neighbor, they can go out and help shop for you. We are committed to sharing timely information about the situation so people can make good decisions about their health. It is important for people to remember that most people with COVID-19 have mild illness. A smaller portion of people will have severe illness, and that's why we want to decrease the spread as much as we can. And I know folks are concerned about the deaths in Washington state. This is again where each of us needs to take some personal responsibility. If I have a loved one in a nursing home or a hospital, I should not go visit them if I'm sick. We need to keep ill people out of our institutions where people are getting care so that they can stay healthy. And the same goes for healthcare workers who would be caring for these folks. So for those with chronic underlying conditions, older adults and people who are pregnant, make sure to pay attention to any symptoms and call your provider. You may need some medication for the flu or another illness. Our COVID-19 hotline is also available for members of the public with questions, and you can call them at 1-800-525-0127 and press pound. Thank you very much.
Did you want to say anything or not? Okay, we're happy to take questions.
Governor, you said that at this point there's no move to under what scenario would that occur?
I wish that we had a simple algorithm that the epidemiologists could offer us, but they really don't exist. There's no algebraic equation that could make this an easy decision when we cancel events or schools. This is a matter of judgment that will be based on the best available science. And fortunately, we have some of the best scientists in the world right here in the state of Washington, on listening to the people whose lives would be affected by those closures, and by trying to ascertain to the extent humanly possible the efficacy of any of these stoppages. There is some, and I've actually personally reviewed some of the medical literature on this, on the efficacy of what is termed social distancing, to try to get distance between people. There is some evidence that they can be effective, and the more they are layered, the more effective they are. So this is a day-to-day decision. We are intensely interested in this. We'll make the right decision at the right time. At the moment, we have taken the right action, which is to ask people to start to think about these questions in their own lives. And I can't reiterate how important individual decision-making is here as individual citizens. That's what we've asked to date.
Governor, the legislature is looking at $100 million, as you mentioned, but one proposal seems to be taking it out of the rainy day fund, and the other might take it out of the general fund. Do you have a preference for that?
No, we haven't expressed any particular preference, but we do want to get this job done. And I may reiterate, we're very hopeful that the U.S. Congress can act on this in just in the next few days, because time is of the essence in building up our stockpile. Our congressional delegation, I think, is doing a really good job. They understand this. We hope the whole Congress can follow our delegation and get this done as soon as humanly possible. That's something we are urging them to act on. So far, finances have not been an issue to restrict our ability to act. We've had adequate testing facilities now. We haven't had to make any prioritization. So we've had adequate testing to test folks within the protocol. So we can't allow finances to be a problem, and so far they have not been.
Governor, question. Again, with expressing condolences
yeah.
to those who have lost loved ones, is there anything that could have been done sooner to save those lives?
I don't know the answer to that question. This goes back, presumably started in China, and if there was a health official in Wuhan, China, who saw the second case and could have done something, heavens no. There's no way of answering that question. I do believe that our state right now is being very alert, very organized, very strategic, and thankfully we have access to the best science in the world. You saw some of that the other day coming out of the University of Washington. So I think we're fortunate to have that working team, and also Washingtonians that are, a level-headed stock who are not going to allow fear and anxiety drive us over the cliff. We're going to make calm decisions. We're not going to let it make us make bad decisions. So we've got all those things going for us, and I'm happy about that.
Governor, in your proclamation, you also activated the National Guard. What is your thinking on that, and what do you foresee them doing in this?
Well, there might be a variety of things the National Guard could do. First off, there's a possibility of providing surge capacity for medical services, for helping administer and actually provide possibly isolation services, as more people potentially could need isolation. They can help in security issues. They can help on organizational issues. There's just a whole host. This is such a talented group of people. So so far we've had fairly limited requests to them, but we want to be ready. I did express to the Vice President when I talked to him that we may be calling on the Department of Defense, and we would hope that that department has extremely important missions for the security of the country, but we hope they'll be willing to be flexible if there are assets we can use from the DoD. Obviously, we have a lot of stations here in Washington that potentially could be of assistance.
What steps are being taken to minimize the risks with mass transit?
That's more of a local decision by the transit authorities, and I would refer you to mostly to them, but I've heard the local officials being very intentional to do everything they can in this regard, regarding disinfecting, facilities, and I believe they're going to do everything they possibly can, and that's the right thing to do. It is a challenge. People need public transit. So this is one of the more challenging aspects, and we'll encourage people and be of assistance to them if they have something that we can help on the state level as well.
Governor, if
Talk about, you mentioned social distancing, and I wondered yourself, how has your schedule changed? And how concerned are you personally about contracting COVID-19?
You know, that's not something I'm really thinking about. I got 7 million people I'm thinking about right now. It has not really changed, except I'm not shaking hands now, so don't be offended. If you're voters out there and I don't shake your hand, don't be offended. This is good hygiene. That's kind of about it on my, and I'm following this advice. I didn't come to work Wednesday. I had a cough Wednesday. I didn't come to work. And it's hard to do, right? We're all wrapped up in our jobs. Our identity is in our jobs. So it's hard to do, but I can't stress how important that is and why that's kind of sounds kind of weird, but it's a bit of a patriotic act right now of not going to work. But maybe we ought to coin a medal or something for folks who follow this advice.
Governor, if those over 60 and those with compromised immune systems are most at risk, how do you get the majority of the population who's not in that group to do some of these things that we're requesting here? How do you get the word out? How do you get action?
Repetition, 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 and that's kind of it. But sometimes, you know, you have to see the consequences of inaction to be convinced. And unfortunately, now that we're seeing fatalities in our state, it would be my hope that people understand how important their individual actions are. Not just for their own protection, even if you're the healthiest dude on the planet. The fact that you don't go to work when you feel badly means you might save your grandmother. And we just need to start thinking about those people around us when we make these decisions.
What kind of capacity does the state have to provide economic disaster relief to companies, maybe in the travel business?
More than one strain of this virus?
You wanna talk
Can
about
you
that,
talk
John?
to that? Because I understand the genetic makeup of the first patient was similar to a 16-year-old, both in Snohomish County, no connection, and not the same as all the other cases.
Right, so sometimes there are sort of minor pairs in the genetic formation that sort of change over time. And those are things we're able to track to see how long we think something's been in a community. So those things happen all the time with flu viruses, and they allow us to help track who's connected to whom and how long something's been in the community.
There's the research that shows that this virus may have been in the community for several weeks, 6, 7 weeks. Is that a conclusion that your folks have come to this? Do you agree with that conclusion?
We're looking at many pieces of data, and we can't confirm that. I think even the report itself basically said it's a possibility. We think that's a possibility. Again, we as public health officials have been anticipating this. As we have seen this virus spread across countries, we anticipated that there would be spread like this, and most likely in the United States with travel as it is today. And given that most of the folks who experience this have mild symptoms, so it was totally anticipated by public health officials.
Let me add something to that, John,
Yes.
if I can. Look, we're under the working assumption that there are any number of people who are perhaps even asymptomatic who have this virus in the state of Washington right now. It's just a working assumption. That's important to say because all of our planning, our surge capacity planning, our additional testing capacity, our isolation planning, all of this are on that working assumption right now. So it's almost an academic question right now, not to show disrespect to your question, but it's just kind of academic. We're having this assumption that, you know, there's going to be continued increasing numbers of this, and we have to be prepared. So that's what we're working on.
Superintendent Breakdown, a quick question for you, sir. There's a lot of worried parents out there I believe one of the districts, Lake Washington, there's a petition going around with about 7,500 parents asking for the school district to close. Are you satisfied with the response, even though there's no official saying that you have to close the school districts? Are you satisfied with the response? Do you have a message for parents or perhaps school districts out there?
I appreciate it. I'm Superintendent Chris Rakedahl. We've got really good protocols in place in the state, and to the credit of the Secretary and Emergency Management, we've been planning for this. We do tabletop exercises. We understand our protocols. It's really important that we consistently message to our districts what we have been telling them. When it comes to epidemiology and sort of this from a health standpoint, this is the call of local departments of health. They're considering a lot of factors. So to date, not a single health department has called for a school shutdown. That has not been their judgment. That said, the law does allow local superintendents to consider other factors. And so out of an abundance of caution, we've had school districts make that decision, either an individual school or in only one case, a school district for a day. But at this point, I'm very satisfied with the fact that they're coordinating so effectively on the ground. They're doing what they think the experts and the science tells them to do. And as you heard from the Secretary, there's no presumption that sending a bunch of students home necessarily changes or enhances outcomes, just given the patterns of what particularly middle schoolers and high schoolers are going to do when they go home. It might be a mall, it might be a movie theater, it might be a lot of other stuff. And so we're listening to the science right now. Our districts are responding as they can appropriately. Where you've seen closures, they are doing that out of abundance of precaution to absolutely clean the facilities. So they're doing on a building-wide level what you heard the Secretary and the Governor say to do. We're washing hands, we're being relentless about those droplets on surfaces, we're cleaning facilities, and when there is a doubt, we're seeing some local superintendents make that decision. But at this point, no local health authority has mandated that.
Just to clarify, do you have the power to shut down schools from your office?
We do not at the Office of Superintendent of Public Instruction. State law makes very clear that our superintendents locally may, for lots of factors, you see it in snow events, you see it when their heating systems break down or water systems. We clearly have the ability of local health authorities to make that a mandate. And what we will do in our office at the Council of the Governor, who has already declared an emergency and subsequent action that may happen at the local level, we will work with school districts one-on-one in establishing what we call our day waivers. There are schools who will have to make up days or will go extra time as a result of this, as well as they would snow days or something else. So we prepare for continuous learning, and we map that out for districts. But at this point, that decision is a local decision.
Secretary, what sort of gear or equipment did you request from the National Stockpile?
Great, thank you for that question. So we requested personal protective equipment for our healthcare workers, so additional N95 masks, gloves, and gowns. These are things that are in the national stockpile for exactly these kind of purposes and have been part of the planning for a number of years now.
How much did they send?
I don't have the exact numbers with me. I know we put in a request, and I think we've got 50% of that's being sent at this point, and look forward to getting 100% of that.
There's a reference to isolation planning. What exactly does that mean?
Isolation planning, so if someone is infected with COVID-19, test positive, isolation really is about staying away and out of the public. We try and do that at home with folks. Try and have folks stay home, stay away from others in their household if they can, preferably to isolate themselves in one room of the home. If it's got a bathroom with it, that's great that they can have their own bathroom. So again, it's basically the techniques to prevent transmitting this virus to others, and our preference really is to do that in people's homes as long as they're well enough to stay there.
Robert, do you want to add anything to that?
It's just a planning that we have been working on in conjunction with Health under Health's lead, looking for different resources, facilities. So for example, if somebody is does not have a home or is unable to stay at home, looking for other options that we can provide them where they can be in isolation, be cared for, and then their needs met.
At 100 tests a day, if that's what I heard the governor say.
100 people a day, 200 tests.
200 tests, 100 people a day. How long before your need for tests outstrips 100 a day? Because if you've got 253 or so already that you're watching, it seems you're going to burn through those in that in a pretty big hurry.
Right, so the folks we're watching aren't people who have been tested, they're simply being monitored for symptoms. The good news here is that the Federal Drug Administration has extended their emergency use authorization, which is allowing commercial and research labs to come on with testing. So here in the next number of days, we will see those commercial tests come online. And over the course of a number of weeks, we anticipate having as many as 5 million tests available each week. So that additional testing is coming really quickly, and we're thankful for that.
We have time for a few more questions.
You mentioned at the outset 18 cases, but there were 50 individuals at the nursing home between the residents and the workers who were being examined. Any update on how many of those individuals? And this morning, we presented to the committee there were 2 known to have passed away. Now there's 6. Has that number changed even this afternoon?
So first of all, Public Health Seattle-King County is in the lead on the nursing home investigation, and so they're going to be the ones who have the best information. As the governor said, the Centers for Disease Control and Prevention has staff on the ground with them doing that investigation in the nursing home. I suspect that there are going to be more tests coming from the nursing home, and would anticipate, it's certainly likely that we could see more cases identified from that. So Public Health Seattle-King County really is in the lead, and we are going to be reporting numbers daily. I think we're going to start reporting numbers daily at 11 in the morning. So that will be able to cover all the tests that we did the previous day.
And all the tests are being done out of Shoreline?
At this moment in time, yes.
Is there a reason you wouldn't test all those people right away?
The test really isn't recommended for folks unless they have symptoms, and so under our current protocols, we really look for somebody who is showing some signs of fever or respiratory issues before we actually do testing.
Is that because of the cost of the test or the accuracy?
No, it's more about getting accurate test results.
And once somebody tests positive, how long do you continue to testing before you, say, release them from treatment?
Right, so that's an ongoing question as this virus is new. How long people shed the virus is uncertain. We know in the first cases that we've had in the United States, some people have shed the virus for as many as 20 days or so. So we're actively doing that research to understand how long people might shed, and then also we don't necessarily know if they're infectious after that. So lots of research coming on that.
Governor, you were critical of the White House at first. Now, are you more satisfied with the messaging coming from the White House?
Well, I will limit my comments by saying it's just really important for all public officials to stick to the truth and the science. And that's very important so that people will have confidence in the information they're getting, and so that hopefully they'll follow some of the good advice about their own health protection. So I hope that that will be the case in the administration. I will say that the administration below the White House has been very cooperative. The CDC had 3 people on the ground here within 24 hours practically. I met with them. They were extremely cooperative. They flew a group, I think, of 20 out here and responding to the nursing home. The federal individuals have been doing a good job, and we appreciate that. Maybe some of the decisions as to timeliness, could have been questionable. We don't have time to argue about that right now. We got to protect people, and that's the job we're doing.
You said you spoke with the Vice President. Have you spoken with President Trump about this?
No. No need right now. Thank you very much. Take care.